Today we will be discussing human herpes virus 2, also commonly known as herpes simplex virus 2 or HHV. Sexually transmitted disease that is characterized by sores on the genitalia or mouth. Transmission of this pathogen can be through kissing or oral, vaginal, and/or anal sex, particularly via skin-to-skin contact or through the exchange of fluids containing HHV-2. Human herpes virus is coated in a viral envelope as seen here, which fuses with the plasma membrane of a cell. These cells are known as epithelial cells due to them being the outermost layer. Post-fusion, the virus enters the cell and infects it. There are generally 3 periods or stages of infection, 2 of which are reoccurring. First, we have the primary infection. HHV-2 viral DNA travels by neuronal axons to sensory spinal cord ganglion. Once arrived at the spinal cord region, the virus remains in a stage of latency. During the latency period, the virus lays dormant, providing the opportunity for the replication of infected cells, as seen here. The final stage is known as reactivation, where clinical signs and symptoms like blister development are noticeable and more prevalent. Next, we will discuss host immune responses. HHV-2 is a persistent infection for a couple of reasons. First, we have the issue of the site of the infection. The skin and the nervous system are known to be immune privileged sites where there is a lacking in superior immune surveillance, like we see in higher vascularized tissues like the liver. Further, once a latent infection has been established, there is no evidence of viral products that are being expressed, making it difficult for the host immune system to attack infected latent cells. Even with these challenges, the host immune response is vital when it comes to blocking and restricting the severity of HHV-2 infection. CTLs, or cytotoxic T cells, are a type of white blood cell that is responsible for going after viral infected cells. Human herpes virus 2 can be diagnosed a few different ways. When meeting with a healthcare provider, they will evaluate the symptoms and clinical presentations that are discussed. Generally, these include fever, swollen lymph nodes, headache, fatigue, genital sores, ulcers, or pain and itching. Once evaluated, a swab, blood sample, or a sample of cerebrospinal fluid can be obtained using a lumbar puncture. To wrap it all up, human herpes virus 2 is a form of herpes virus. This means that once you have contracted the sexually transmitted pathogen, you will have it for life, leaving the chance for persistent and recurring infection. To help with the prevention of contracting the virus, the practice of safe sex or the use of condoms and dental dams is highly recommended. Over-the-counter medications are also available. Abreva is one example of an over-the-counter medication that can be used to treat oral sores that develop. Thanks for joining and learning about human herpes virus 2.